that can occur in the workplace, and amongst the most common are cuts and bleeding. These can range from small scratches through to serious cuts, embedded objects, amputations, and injuries that can lead to internal bleeding. Many bleeding incidents are not severe and can be treated with simple first aid and the body's own ability to clot. Some are more serious and require urgent action. Serious bleeding that is not stopped quickly is life-threatening. Blood is composed of a liquid component called plasma and three other major components: red blood cells, white blood cells, and platelets. Red blood cells perform the function of delivering oxygen and removing carbon dioxide from the body's cells. White blood cells are a major part of the body's immune system, fighting infection and producing antibodies to ward off infection. And platelets aid in the blood's clotting mechanisms. Blood also performs a major function in maintaining a constant body temperature. There are three types of blood vessels: arteries, veins, and capillaries. Arterial bleeding is not common, as arteries are usually deep within the body's tissues. Arterial bleeding will spurt and be profuse. It is difficult to control and difficult for blood clots to form. It will be bright red, as it contains red blood cells that are highly oxygenated. Bleeding from an injury to the veins is much more common. It's easier to control, it's under less pressure, and it's easier for clots to form. Blood from the veins is not highly oxygenated and will be darker in color. Capillary bleeding is very common, as the capillaries are close to the skin surface. Capillary bleeding tends to ooze as it is under low pressure and is easy to control. The body's natural defense in dealing with blood loss is to increase circulation and reduce blood pressure.